Ultimately, precision is one of the main goals we have here while we're treating clients. Precision is going to yield way better outcomes in all three phases, if you will. So ultimately, that's why we have an ultrasound machine, to be able to look into joints and muscles and see exactly what we're doing for injections. I'm dabbling with it for assessment techniques and purposes. Dr. Berghamer here is teaching courses on how to do this. I definitely refer to you. A lot of times it's extremely handy to have someone who's very well acquainted with this technique. He can confirm, rule in or rule out any of my concerns or findings. So I will oftentimes take the client in and assess a shoulder or a knee or a hip or something like that, and then refer to Dr. Berghamer's second opinion on these things. So it's extremely handy. Once again, I intimated earlier that without identifying source, how are you supposed to make an effective treatment plan?
Agreed.
So,
I mean, there's a lot of practitioners out there who will claim that palpation-guided or blind injections are as effective as ultrasound. And in my opinion and experience as a former palpation-guided injector, ultrasound allows us to be precise. It allows us to see those areas that are damaged or are concerning. It allows us to be able to put the needle exactly where we want to put it. We can confirm our placement. We can confirm that the needle is inside the joint. And then we can also offer that confidence to the patient.
So there are a few things that are going to determine the effectiveness of that treatment in an orthobiological fashion. One is going to be the quality of our solution, if you will. Two would be the state of the patient, their health. And then three, ultimately, is precision of injection.
That's right. And in the context of, injection therapies by themselves are fairly ineffective if you're not looking at it from the whole person. So an injection therapy, to be able to help fix a problem, in the context of something like force balance technique, results in treatment of the whole person. And this is where success lies. Putting the needle where the problem is only a small part of the entire program.
It's my feeling as well, with the recent decision handed down by Health Canada in May of this year to discontinue the use of stem cells. I was walking a very, very fragile edge there for a while, very anxious moments, wondering what their position on PRP was going to be. Thankfully, they have allowed this to continue with some guidance. I wish they would have went one step further and insisted upon guided injection. I mean, let's just not even consider the effectiveness of the treatment outcome. Let's talk about something probably more important: safety.
Yes.
Safety first, right? I've heard, I don't want to get into it, but I have a handful of stories.
Yes.
I mean, if you're going to have some injections done into your lower back, and that practitioner has a 4-inch needle, I surmise you would probably feel a little bit more comfortable if it was under ultrasound guidance as opposed to palpation guided.
Absolutely.